Hi, it's Ruth Royal here from Youth Pledge for Employers, and I'm really delighted to be talking to Helen Fairweather today, who's Chief Executive at Headway. Hi, Helen, lovely to meet you.
Good morning. Thank you for inviting me.
Oh, we were so pleased you could be here. So, Helen, tell us a little bit about Headway and what your organisation does.
Okay, so there's lots of Headway groups around the country, but we're all individual charities and companies in our own right. So I manage Headway Suffolk, and we look after people with any neurological conditions. So that can be very young people from 16 years upwards to people in their 90s and anything in between. We see a whole range of people from community, people who have been limited in education, right up to hospital consultants who find that they themselves now need care, both male and female. Brain injury and other neuro conditions are indiscriminate, so it can happen to anybody at any time. And if people have a traumatic brain injury or stroke, it can be without warning. But we see a whole range of different symptoms and lack of skills that people then experience. So it could be very short-term memory. So some people only have a memory lasting a minute. So everything is new news to them. Very poor concentration. They could have physical disabilities, so not be able to walk, maybe not be able to speak, might just say one or two words, might say the wrong word in the wrong place, might have a language unique to them. And we do see some behaviour that challenges, but nobody that's violent. And a lot of that time, that is pure frustration. You imagine if you're talking to somebody and you think you're saying the right word and the person's not understanding you, that leads to huge frustration. And some of them can remember what life was like before, the high-powered jobs they had and the things that they could do that now they cannot do. So we see a lot of mental health problems as well. So I always think if somebody's looking for a career in medicine, nursing, any of the clinical therapies or care, Headway is a really good grounding because you come across so many different people with a whole range of different disabilities and problems.
Oh, that is absolutely fascinating and so shocking to think about how that can affect people unexpectedly and at different points of their lives. Could you tell us a bit about the different sorts of jobs that people do in Headway to support people, and maybe perhaps thinking probably more broadly as well?
Absolutely. So we do take a lot of people straight from school on apprenticeships. So they then end up with a level 2 or 3 in health and social care. What level they do depends on how well they did at GCSEs, especially in maths and English. And we train them to be really good care assistants or support workers, and in particular in neurology, because we very much hope that after the apprenticeship, which lasts for about a year, they'll go on to work for us. So the apprenticeship is spent mainly in our Ipswich hub, where again they work under supervision and they get a whole experience of working in care. Towards the end of their apprenticeship, they would be invited to go and work in our home care department as a double assist. So double assist is where 2 carers have to go in. And that could be because we're using things such as hoists, or there's inappropriate behaviour, or to safeguard the staff. So we invite them to go in to our home care department. And in home care, we're delivering care in people's own homes. So it's personal care. It could be given medication, so they'll be trained to do that, cooking a meal or light housework. We also have community support where we take people out and about to any leisure activity. It could be shopping, it could be to a GP appointment, anything that they want to do in their community but can't do without support. As I said, we see clients with mental health problems, therefore we do employ a mental health nurse. So she carries out most of our assessments. Most of our clients will have some form of mental health problem, even with just light depression or anxiety. So it's great having a mental health nurse who can give the staff advice, but also help our clients and our family carers. We employ physiotherapists, occupational therapists. From time to time, in fact, most years, we have social work students who are doing a social work degree, either at Suffolk University or the Anglian Ruskin University. They come to us on long placements for 100 days to find out what it's like to have a brain injury and to work with people with brain injury. We have cooks who provide meals in our hubs. We obviously have a whole range of admin assistants. We have accountants. Our current accountant came to us more or less straight from school, worked for us as sort of an admin assistant, and under our encouragement, took out level 7 in accountancy, so he's now a qualified accountant. And that's how we want to see young people progress. So this week we've taken on a young person who's coming to us one afternoon a week for work experience, and I said to them, the last person who did that in sixth form, then did an apprenticeship, was then employed as a support worker and is now a senior support worker with us. So we really celebrate when young people are able to progress and stay with us. It's absolutely fantastic. So most of our employees are actually support workers. Obviously, we have managers, registered managers. We are registered with CQC. We just had our inspection, and we're expecting to get at least a good, if not an outstanding, in that. They're really impressed with what we did. And one of the categories they're really impressed with was well led. They felt the staff team were really well supported. And I think that's really important for young people starting careers, that they have a really good grounding and get lots of support from management. So there's a whole raft of jobs that people can experience within Headway Suffolk.
That is absolutely fascinating, and I love that you're growing your own in terms of your staff skills and the dedication and the time that goes into that. You've obviously touched on sort of the entry points for the level 2, level 3 apprenticeships, and obviously the importance of maths and English there in terms of defining the level that you would go in at. Are there other sort of broader qualities that you look for when you're recruiting into those positions?
We look for commitment. So it is important that people turn up on time, because otherwise we're letting down our clients, especially in home care. You know, if a visit is booked at 8 o'clock, it's really important that people are there at 8 o'clock. So we expect that right from day one with our apprentices, that they turn up at work on time. And, you know, they're clean and properly dressed. We do have a code of dress, so we wear polo shirts and black trousers, and we expect staff to do that. Obviously, infection control is extremely important to us at the moment because of COVID, but in any time it's important. But it's that empathy, and I can't teach that. That's the understanding and wanting to care and give a really good service. I can teach about neurology, I can teach how to deliver care. I can't teach passion. And it's the passion we look for. I touched on apprenticeships, but we also take people who have done a degree, particularly in psychology, who might want to go on to be clinical psychologists, but need that practical help. So we've just recruited a couple of people who've just done their masters in psychology, but before they can go on to be psychologists, need that hands-on practical input. So we know we might only keep them for a couple of years and we'll be sad when they leave. It's really good to know we've helped people on their career path.
Oh, that is fascinating. And I love that there are those sort of different entry points for people with different skills and interests as well into the organisation. What do you think sort of the culture of the organisation is like? What's it like to work for Headway as an employee?
I mean, surprisingly, with all the conditions and problems our clients have, it's a really happy place. A lot of our clients feel they're very lucky they survived whatever it is that they've been through, and they support each other. And that, I think, is throughout the organisation. We do support each other, we do care. There's always managers on call, and we care about people outside work. So if there's something affecting them in their personal life, and there's obviously an effect on their work, then we want to know that. So all our staff have at least monthly supervisions with their line manager, annual appraisals. Alongside the official apprenticeship, there's other courses and training we do. So I think it's a caring, supportive environment, and I say it's extremely happy, which you wouldn't necessarily expect.
What was your journey into your current role? Because obviously you're now Chief Executive. It'd be really interesting to hear a bit about how you ended up in your position.
Okay, so I'm incredibly old. So I was educated when we actually had grammar school. So I had a grammar school education. But having said that, I was under parental pressure to leave at 16, which I did with 7 GCSEs. I then decided that actually I wanted more for me than that. So I went to evening school and I did A-levels. In fact, one A-level, I just picked up the work, went back a year later and did the exam and got an A. And I can remember the lecturer saying to me, just think how well you'd have done if you'd attended lessons. And I thought, but an A is as high as you can get. And they then said, go on to do a degree. I didn't have the luxury of going to university because I didn't have parental support. So I then did a distance learning degree in early childhood education with the University of North London, which I passed. Spent some years in teaching, and then wanted to come out of that for various reasons and started looking at jobs in the voluntary sector. In fact, the first one was the Preschool Learning Alliance because that fitted in with my degree. And it wasn't, none of this was planned really, it's things that just happened. So I worked for a couple of other charities, then saw Headway Ipswich and East Suffolk was in advertising for a manager. So I took on that role, applied for it, took it on, and then decided that because I was working with clinicians who got a degree, I actually needed to be more highly qualified than them. So I then did my master's degree with OU. And then Headway's grown. I decided to grow with Headway. I had two options, either to leave Headway and go elsewhere or to grow the charity. And I decided to stay and grow the charity. So we went from a small daycare centre. We merged with West Suffolk Headway to become Headway Suffolk. We're now one of the largest Headway groups in the UK. We have various hubs, rehabilitation hubs throughout the county. We have a massive home care team with clinicians, and I say mental health nurses. So I grew with the charity, but a lot of that was down to my determination, my commitment to myself and to the charity that I work for. So I wasn't one of these people who had the luxury of leaving school with lots of qualifications, being able to go to university. That just wasn't for me, wasn't what I was being able to do. But for people who do not have that parental support or financial support, there are other ways of doing it. And I now feel that I'm quite an advocate for OU in particular. I've encouraged 2 of my staff this year to enrol on OU courses to do a health and social care degree. And I said that I'll mentor them and help them through that.
What a fantastic and inspiring story. And actually, like you say, that sort of what you can do if you really want to achieve something. It reminds me of that thing that people say, you know, if you don't want to learn, no one can make you. But if you do want to learn, no one can stop you. And that's absolutely, I think you're a complete testament to that, Helen. That's fascinating to hear, and the passion and the proactivity that you put not only into that, but how that's reflected in your work at Headway to grow the business and grow the charity. Probably my final question is, if you were to go back and have a conversation with young Helen at the start of your career journey, what piece of careers advice would you give yourself?
Not to give up. Not to let other people put you down, to believe in yourself. If a door is closed, look for one that's open. And, you know, school and education is important, but it's not the end of it. There are other ways of getting a good career. So commitment. I always did work hard, and I think that pays off.
Oh, Helen, that's a brilliant note to end on. Thank you so much for giving up your time today. It's been great to meet you.
You're very welcome. Thank you.